A heart palpitation is noticeable when it feels like your heart skipped a beat, or had an extra beat. It may cause fluttering or pounding in the chest or neck. It can also be a sudden increase in your heart rate. Heart palpitations don't always happen when you're doing something strenuous or stressful, and they may not be a symptom of anything serious. The food-heart connection. You may experience heart palpitations after eating for several reasons. Dietary supplements. Some dietary supplements people take with meals may cause heart palpitations, including bitter orange, which some people take for heartburn, weight loss, and skin issues. Ephedra, which some people take for colds, headaches, and increasing their energy levels. Ginseng, which some people take for increasing mental and physical energy. Hawthorn, which some people take for heart conditions, including angina. Valerian, which some people take for sleep disorders, anxiety, and depression. Meal experience. Heart palpitations after eating may be related to the meal experience, rather than the food. Palpitations can occur due to the act of swallowing. You may sometimes feel palpitations when standing up after being seated for a meal. Emotions can also trigger palpitations, especially if your mealtimes cause anxiety or stress. Diet. Your diet can also cause palpitations. The following are some diet-related triggers and risk factors. Low potassium levels and dehydration can trigger heart palpitations. If you've been diagnosed with hypoglycemia or low blood sugar, you may be at higher risk for having heart palpitations due to your diet. High carbohydrate foods and processed sugars can cause palpitations if you have issues with low blood sugar. Alcohol can also play a role. Researchers in a 2014 study in the Journal of the American College of Cardiology found a link between alcohol consumption and atrial fibrillation. You could have palpitations due to a food allergy or sensitivity. Heartburn that occurs due to eating spicy or rich foods can also trigger heart palpitations. High sodium foods can cause palpitations too. Many common foods, especially canned or processed foods, contain sodium as a preservative. Tyramine. Foods and drinks with high levels of the amino acid tyramine can cause your blood pressure to increase and lead to heart palpitations. They include aged cheeses, cured meats, alcoholic beverages, dried or overripe fruit. Theobromine. Theobromine, an ingredient commonly found in chocolate, can also increase your heart rate and cause palpitations. Researchers in one study found that theobromine could have a positive effect on your moods. But at high doses, its effects are no longer beneficial. Is caffeine a trigger? Traditionally, doctors believed that palpitations could result from caffeine sensitivity. However, a January 2016 study suggests that caffeine likely doesn't cause palpitations. In fact, the researchers propose that some types of caffeine can improve your heart health. Other causes. Exercise can make you prone to having heart palpitations. Feeling emotions like fear and panic can also cause them. Drugs. Other causes include over-the-counter products, such as cold medications and decongestants with a stimulant effect, medications for asthma, medications for heart disease, medications for high blood pressure, diet pills, thyroid hormones, certain antibiotics, amphetamines, cocaine, nicotine. Hormonal changes. Drastic changes in your hormones can cause palpitations too. Going through a menstrual cycle, pregnancy, or menopause affects your hormone levels, and these changes can have a noticeable impact on your heart rate. Hot flashes during menopause are notable for causing palpitations. These usually disappear when the hot flash is over. Some heart conditions can put you at risk for heart palpitations, including an abnormal heart rate or arrhythmia, a rapid heart rate or tachycardia, a slow heart rate or bradycardia, atrial fibrillation, atrial flutter, ischemic heart disease, or hardening of the arteries. These heart issues can occur due to existing conditions, including diabetes and high blood pressure. Talk to your doctor about getting tested for heart conditions if you have heart palpitations, especially if you have other conditions that can affect your heart's health. If your palpitations aren't due to an underlying medical condition, you may not need medical treatment. If you have palpitations often, try to figure out what foods or activities trigger them. Keep a food diary to see if you can identify specific foods that give you palpitations. In some cases, a single ingredient in your food may be causing them. If you can identify triggers, avoid them and see if the palpitations stop. If you're under a lot of stress, therapies such as yoga, meditation, and deep breathing techniques can help alleviate heart palpitations. No matter what's causing your palpitations, many treatments are available to help keep your heart rate in check.